What emerges from this conversation is a picture of a system under pressure, from high drug prices to insurance barriers that even a congressman struggled to navigate. The proposal behind Trump RX aims to inject transparency and competition, yet its real test will be whether ordinary patients feel the difference at the pharmacy counter. Healthcare reform often sounds promising in theory, but collides with complex realities in practice. What do you think? Can government-negotiated pricing truly fix these long-standing problems? Share your thoughts below, and don't forget to like, comment, and subscribe for more balanced, fact-based analysis.
First of all, just tell us how this site, Trump RX, is different from other cash pay discount sites like GoodRx.
Well, these are U.S. government negotiated most favored nation prices. Let me explain what that means. Generally, in America, until just now, we would pay on average 3 times more for every medication we were taking, even if it was made in a U.S. facility, than they pay for that same drug over in Europe or in Asia. Doesn't make any sense. You might wonder, how's that possible? Folks were getting away with it, so they charged. The president came in and said, we're not going to tolerate that anymore. Confront these pharmaceutical manufacturers face to face, look them in the eyes and say, this is not fair, it's not right. There's global freeloading on American taxpayers. We're going to make the prices fair, and that's called most favored nation pricing. We negotiated it all, but how do the people of America get those prices? TrumpRx.gov is that solution. It was built by Joe Gebbia, who built Airbnb. The wonderful engineer Ed Kornstein actually made the software, which is why the site is working so beautifully. And it is an elegant solution to the problem facing so many Americans, especially cash-paying Americans, folks who don't have great insurance, folks who can't afford asthma drugs, insulin, they can't get the fertility drugs. 1 in 3 babies, families are underbabied. How do they make children if they can't afford the medications? And with 90% discounts, we have an ability now to completely reset expectations for the American people and be able to save money while also saving lives.
And as you point out, the site works by targeting people who are willing to pay cash for their prescriptions rather than insurance plans. But it's unclear if all of the patients, especially those with insurance, will see cost savings from the site to buy their medicines. For Americans who are paying thousands of dollars in insurance premiums each year, what do you say to them?
Well, the best disinfectant is sunlight, transparency. And this is a big part of our hope with the great healthcare plan. Make it easy in plain English to understand what you're really getting. Now that everyone knows the true worldwide most fair nation drug prices, it's going to allow employers, insurers, and everyone in between to be able to take out the middlemen and drive those prices down. But our primary concern was for a couple groups. We wanted people on Medicaid. We wanted state governments to get inexpensive drug pricing. We want to make sure all the cash pay patients can now get these medications. Well, if you want to go on a GLP-1 drug, a weight loss drug, and you just announced, and I'll share this and make sure everyone understands it, these aren't just shots, they're pills now.
Like Ozempic or Wegovy.
Exactly. Now, Pam looks like a gazelle. You probably don't need it. But there are plenty of people who need these medications desperately and they can't afford them. The number 1 zip code for these GLP-1 drugs is Upper East Side of Manhattan, because people have money. Why can't folks in the South Side of Chicago or folks living in poverty in rural America get access to these meds? At $150 a month, not only can they get them, if they want to buy them on their own, they can. And here's the best part. Within 2 years, we will save money for the taxpayer, because when you reduce obesity rates, you reduce high blood pressure and diabetes and all the downstream illnesses, heart disease, kidney disease, brain disease, and now you're spending less money dealing with chronic illness because people are healthier and they feel better.
Yeah, and certainly I think a lot of Americans welcome lower drug prices. That is a big deal. But of course, you have to look at the bigger picture too, right? I mean, you mentioned more families having kids. This could help with that. But then child care costs, of course, are a factor. Health care costs, a factor. I know the Wall Street Journal is reporting that you've held frequent talks with the president.
Lower prices sound simple, but the healthcare marketplace rarely is. What we're hearing is a promise to bypass insurers and pharmacy benefit managers by using government-negotiated rates. Supporters say this could finally expose hidden markups. Critics warn it may shift costs elsewhere. The larger question is whether a website alone can overcome decades of structural problems like insurance premiums, prior authorizations, and regional inequality. If medicines become cheaper for cash buyers, will insured patients still carry the burden? And should access to essential drugs depend on where someone lives or how much they earn?
About healthcare in the U.S., I want us to take a listen to Republican Congressman Greg Murphy of North Carolina, questioning health insurance CEOs during a hearing last month. He was really fired up. As you may know, he was a physician for more than 30 years. Let's listen.
But you all have been very derelict in your duty and abuse this position of authority. There has been systematic denial and delay of care. It took me 8 denials myself to get a medicine that I need to exist. A year and a half. I'm a physician and a member of Congress. It took me 8 times through CVS to get that medication. I didn't pull any strings. I did what I was supposed to do. Imagine the average person in the country.
I know, again, you talked to the president. Does he recognize what the congressman had to say about insurance company and how they might take advantage of the average American, and what can be done about this?
The president not only recognizes it, he's actually started doing things about it.
The debate over prescription drug prices has become one of the most personal economic issues in America. Families are choosing between medicine and rent, while policymakers argue over who is really responsible for the soaring costs. In this interview, a key supporter of the Trump RX initiative explains how the platform claims to bypass middlemen and deliver government-negotiated prices directly to consumers. But will this solution truly reach the people who need it most? Or is it another experiment in a complicated healthcare system?
And I'll give you one concrete example, which is, I think, a differentiating element of what the president's been able to do. He believes in the power to convene. He's a deal maker. You bring people together who normally wouldn't talk to each other, and you tell them to put their swords away, sheathe them. That's what meek means. Put the sword away and actually talk. He asked us to go to all the insurance companies, and Chris Klump did this for us. He runs Medicare. And he got them all to say, listen, this does not work when you do prior authorization the way that Greg described. By the way, he still practices urologist. And so what he's describing is a real lived experience for him. And we got all these companies to agree that by the end of this year, they're going to deal with the prior authorization crisis. Prior authorization, again, you're having a precious discussion with your doctor. The insurance company puts their long arm in there, interferes with that sacred conversation, and that covenant gets violated. From now on, they're going to rapidly, hopefully real time, say yes or no to a treatment, come up with better ideas for how to actually use the system. We need some element of prior authorization because it does reduce wrong procedures, things that shouldn't be done. But I'll give you an example of an idea that's been come up with, again, by industry that we support. Gold carding. What does that mean? If you're an insurance company that does not interfere with a doctor because the doctor's so good he doesn't need it, and your patients are getting great care, they automatically have to get to take whatever care they want. No one interferes. No delays on prescriptions or treatments. However, if you got a problem, you don't get that gold card. Now all the doctors want to get the gold card. Why? Because every doctor I know of wants to be in the top half of his class. We all think we were, by the way. And patients, more importantly, can pick the doctors based on who does better following evidence-based guidelines. This is a crisis that we can handle, and we've got our arms around it, and ones like that should be addressable, and we're going to make a lot of noise until we fix them. The president will not tolerate being second best, whether it comes to drug prices, prior authorization, or half a dozen other issues, like when you get confused almost on purpose by the reports you get from hospitals and insurance companies. That's part of the Great American Health Plan. We're not going to allow that to continue.